So here today with me to discuss the ideas of healthcare versus disease care is Dr. Arland Hill. Dr. Hill is a chiropractor. He also has a master's in public health, and he is a doctor who has a diplomate and is board certified in clinical nutrition. So welcome, Dr. Hill. How are you doing?
I'm good, Dr. Stowe. Thank you.
So tell me how you feel. Give me your opinion of the state of healthcare versus my idea of disease care here in this country today.
Well, I think probably the easiest place to start with this is to look at what patients are coming into my clinic saying to me. The average patient that I'm seeing come in has been to a number of other clinicians to try to seek help for their primary complaint.
Medical doctors.
Yes, definitely would be included in that list. But they're not getting resolution. And I think it's probably a philosophical difference in view in the way healthcare is looked at. And it goes very much to what you've spoken about in the earlier segments, is looking at things from a disease care model where you have to wait until you have a named condition that you can attach something to or have a treatment protocol to address it with. However, that's not the average person walking into a clinical setting. That average person hasn't gotten to that disease state yet. They don't have a specific named condition. They may have a named symptom, but not a named condition. And truly for the average patient, there really isn't a treatment approach set up in our standard healthcare model to address that gray area that a lot of people find themselves in. Best example I can give you on this, and this is probably one of the more common complaints out there, is fatigue. So many people complain about fatigue. Well, there are numerous causes for fatigue. So we really don't have a medication. I mean, you can think about the medication ads you see on TV. You're not seeing those for a medication being prescribed for fatigue. But if so many people are complaining about that, then there must be a reason for it.
Right.
So, really there needs to be some path to better investigate what those reasonings are. And our current healthcare model is not really set up to do that at this point.
And so a patient comes in to their medical doctor, and I too have had many patients come to me with the same symptomology. They're in their mid-40s, 50s, even 60s. They are tired all the time. They can't seem to concentrate, male and female alike. They have no trauma in their life as far as physical trauma, and they're not the person they used to be. I get the story that they've been to their medical doctor, and a lot of time, if it's a female, they've been given antidepressants
Sure.
or anti-anxiety drugs or sleep aids or something like that, and they're telling me, I don't want to do this. And so I know what I do, but I want to hear what you do. Why is it that our healthcare society, our model, isn't treating these patients? What are we doing, you and I doing differently than what the medical community is doing?
Right, and I think the healthcare model has almost become a product of our society now. I mean, we all recognize that we live in a high-paced, fast-paced society, and just as we want, quick information, we have our cell phones, our tablets, the computer at our fingertips now. We can get that quick information. We want a quick solution to the problems that we're faced with. So I think that the current medical environment has almost been driven to respond in that manner, but I think some of this falls back on the patient as well, and really looking at within themselves how they have deviated from what just the basics of life should be. Having a good diet, finding time to rest, an adequate amount each day, taking some downtime, getting routine, adequate amounts of exercise. The lack of requests from the patient for that from the medical community has almost driven a system for us where those things aren't talked about anymore. They're not considered a necessity. They're not considered part of health maintenance. And those are core concepts that if they're not being addressed, then health is not really something that can be adequately achieved.
But fatigue is one thing, but let's take it one step further. The chronic low back pain, the patient with fibromyalgia as a diagnosed condition, because my understanding of fibromyalgia is it's a symptom, not a symptom, a disease of last resort. They don't know what else is going on with the patient, so here's your disease title.
Sure.
So I treat them one way, but is there a better model for patients, or what can patients do when they get that label or they have that condition that no one has an answer for?
Well, and I think the statistics on that particular condition alone, I mean, you're realistically looking at probably 10% of the people that actually truly get that diagnosis actually have some type of central nervous system processing disorder that is exacerbating their pain signals. What about the other 90%?
Right.
That other 90% is what's getting missed out there. These are people that have functional issues. These are the groups of patients that need somebody to take the time to listen to them, to have a better understanding of what it actually is that's going on in their life that's leading them to that fibromyalgia-like presentation that they have. And that's, unfortunately, that's not what's getting done. And even a lot of times when when the clinician takes the time to listen, the follow-through on the back end to actually help that individual implement those lifestyle changes, it's not done. It's one thing to make a recommendation to someone. It's another thing to take the time to see that recommendation through.
Now, you said something a moment ago that you and I know, but the audience may not. You said the functional side, the function of health. You and I know what that is, but for our audience, tell them what you mean by that.
What I'm explaining here is it's a continuum, if you will, where and I guess I can best liken this to standard labs, which most people are looking at, are familiar with looking at. So
standard blood labs.
Standard blood labs. So something like, say, a cholesterol or a lipid profile, where you're looking at that particular marker, your cholesterol, at that moment in time. Well, that's really the only information you get about that, is that what was that particular marker at that time. A functional assessment really looks at how the body is working on a day-to-day basis. It allows you to see patterns and trends that we know from medical literature is part of the continuum towards development of disease. So rather than ending up with a disease, a person doesn't go from a normal state to a disease state. They go from a normal state through a continuum of dysfunction to a disease state. So if we have a method to be able to assess through that state of dysfunction, then we know how to address it before an individual ever gets over to the disease state.
Well, and something else that I've found is that I have people bring me blood labs and there's no H's or L's on the sheet. There's no highs and lows. So they hand them to me and they say, my medical doctor says that everything's normal. Right. I look at it from a functional standpoint and I see B6 through an MCH-MCV. You won't know what that is, but we do. Or I see that they have an anemia going on, or their TSH, part of the thyroid, is normal, but the rest of the thyroid isn't.
Right.
So that's another major difference. That is what you're talking about in that continuum of functional, going from normal to the disease state. That's in that
Right.
continuum.
Right. You're right. It's not waiting until you've got a lab value that is clinically out of range. It's looking at the trends and where those lab values are going, because if they're trending for a reason. So just because they haven't quite gotten to that out of range value yet, doesn't mean that there's not something occurring with that patient.
And then we've got to wrap it up. We're almost done, but one quick question answer. How many people do you see that have been to other professionals and they come in and they've got gut issues that probably could be the reason for their condition?
I would say at a minimum, probably 75%. And it's a pretty easy correlation as to why that's taking place, because if you look at what the average individual is out there consuming, it's not a healthy diet.
Right.
And we know that it all has to start with a healthy diet. If you're not consuming the right types of food, you can't expect the gastrointestinal tract to be healthy, and the gastrointestinal tract really is the gateway system into the rest of the body.
We have to end it there, but what I want to explain is what Dr. Hill just said, that my first 3 stories, the news stories, were about vitamin C and selenium and some other nutrients, L-carnitine, that these disease patients, pancreatic cancer and the like, were not being treated. They were being treated with, but they were unhealthy because they were deficient in the nutrient. Dr. Hill and I see these conditions virtually every day, and we see that the gut is one of the primary causes. And again, I go back to the fact that our medical model today looks at the disease, not at health care. Or it's disease care, not health care.